Universal credit, that's the main means-tested benefit for low-income people. Once that's fully rolled out, which it will be fairly shortly, there'll be about 8 million families entitled to that. That's 29% of working-age families.
Hello and welcome to this edition of the IFS Zooms In. I'm Paul Johnson, Director of the Institute for Fiscal Studies, and over this summer we're bringing you a series of briefings on some of the key challenges and policy options facing the new set of government ministers. And today we're going to look at the working age benefit system, how it works, what the short-term challenges are, and what government can do to fix it. And as we'll hear, it is very big indeed. After the health service and pensions, there is nothing that the government spends more on than working age benefits. So to look at that, I'm joined by my two colleagues, Tom Waters and Carl Emmerson. Let's just start off by focusing a little bit into what I just said. It's really quite big, isn't it? I mean, what does the government spend on benefits? How many working age benefits we're talking about here? How many people receive them? I don't think a lot of people quite have their heads round just what a large fraction of people actually do receive benefits at any one time.
I think that's definitely right. So total spending on working age benefits is something in the neighbourhood of about £140 billion a year. And how many people...
140 billion, that's a serious number.
Yeah.
I mean, that's, twice the education budget and 3 times the defence budget. Is that sort of order of magnitude, taking money from us in taxes and giving it straight back to people of working age and benefits?
Exactly. Yeah, exactly. And although it is less than the amount we spend on pensioner benefits.
It is.
An important piece of context. So how many people get these benefits? In one sense, it seems like that should be a simple question to answer. But the truth is we don't really know, because people can get lots of different benefits. And, you might get, you get child benefit and you get universal credit and so on. And perhaps surprisingly, the government doesn't routinely at least work out how many people get at least one of these benefits. But to give kind of like a sense of scale, universal credit, that's the main means-tested benefit for low-income people. Once that's fully rolled out, which it will be fairly shortly, I think it's something I'm going to come on to later, there'll be about 8 million families entitled to that. That's 29% of working-age families.
So let's just halt on that. There's a lot more to the working age benefit system than universal credit, but universal credit is, in a sense, the biggest bit. It's this benefit that was created by the last government, bringing together most of the means-tested benefits that previously existed into one means-tested benefits. And you have to be on low income to get this. You have to be out of work or on low pay. And just so listeners kind of get this into their heads, 8 million families, almost 1 in 3, 29% of working age people will be in a family entitled to universal credit. I mean, that's a lot of people, just to repeat myself.
Yeah, and then that's at any one time, because, of course, people come in and out of work. How many people will be entitled over the period of 10 years or over the period of their life, it's going to be substantially more than that. Previous work we've done suggests it'll be, definitely north of 50% people get it at some point in their life.
So more than half of people will be entitled to universal credit at some point in their life.
Yeah, that's very likely. And then so that's universal credit. You also got a few million other people who are on child benefit, but nothing else. And then another number, I reckon probably in the order of a few 100,000 that get disability benefits, but don't get one of the other benefits we've already talked about. So kind of putting those things together, you're definitely into the low 10 millions, more than 10 million.
More than 10 million families. More than 10 million families on some sort of benefits. Actually, that's surprising. I didn't realise it was such a small number of people who got disability benefits and nothing else. So there's a lot of people who get disability benefits, but they're almost all on some of these other benefits.
Yeah,
right?
a lot of them are on universal credit. I don't really know exactly how many are on child benefit for exactly the reason you just said. The government doesn't bring this together.
Let's come back to child benefit, as it were, ignore that for a bit. But so universal credit is the biggest part of the system, and that gives you money in respect of you and any children. You get more if you're become a housing cost, if you're a renter. You get an uplift if you have a disability. So that's the biggest. Then there's the disability and incapacity benefits, and particularly disability benefit, which is a separate thing. Yeah, exactly. So if you have a health condition, which is the kind of thing that might lead to you having higher living costs, maybe you need to, you find it more difficult to get around, so you need taxis, that sort of thing. Those sorts of conditions can entitle you to disability benefits. Really the main one, almost now the only one for working age people, is called personal independence payment, or PIP. And that's
that's something which perhaps we'll come on to very shortly, but that's received by something in the order of 4 million adults at the moment.
4 million adults. That again is it probably to a lot of people feels like a surprisingly big number. So what fraction of working age adults is this?
It's something in the order of 10%. Yeah,
10%. So again, quite a large fraction of working adults on disability benefits, nearly 3 in 10 on universal credit. And the reason I'm going on and on about this is just so that everyone who's listening really gets that this is not, as it were, that the working age benefit system is not something which affects a small number of ultra poor people or a small number of people who are extremely severely disabled. This is a system that affects a large fraction at any one time of the working age population, and as Tom suggested, probably more than half of people at some point during their working life. So this really, really matters, even if you yourself are not receiving one of these benefits. So those are the big ones in terms of the scale of spending and the number of people on. Have we missed anything significant out between universal credit and personal independence payment?
Well, and child benefit, which we touched very briefly on, which maybe we'll come back to a bit later. But that's most families with children are entitled to that, about 3/4 of families with children.
Yeah. And it's worth saying that we're now not separating out housing benefit here because that comes as part of universal credit. But the housing element of universal credit is itself quite significant, isn't it?
Yeah, exactly. So spending for working age people, when you put together on housing support, is about £29 billion. It's also people, pensioners, who get it as well. But 29 billion of which, most of that is at the moment coming through universal credit, or will be shortly, and some of it through the old housing benefit scheme.
And again, just pause on that number: £29 billion just to support the rental costs, the housing costs of people of working age who have got incomes that are low enough that we deem that they need help to pay their rent. That's what is it? That's 2.5 times the overseas aid bill, something like that. It's a lot more than we spend on the police. It's it's not quite half of it really is half the school's budget. I mean these are just staggeringly big numbers, and I'm not saying that as a way, by the way, of suggesting these numbers are too big. I'm just saying that they are very big, and each one of these benefits, in a sense, is often bigger than whole departments of state. The universal credit budget is way bigger than the Home Office and the Justice Department, for example. So that's the sort of scale that we're looking at. I'll stop being hyperbolic. I'll stop being hyperbolic in a moment. So that's just given us a sense of this being a big thing. But as I said at the beginning of this, what we're doing at the moment is a series looking at some of the challenges facing the government. Clearly, that they're going to take a look at something that's as big as this. But Carl, perhaps you could tell us here, if you were briefing Liz Kendall on the issues facing her today, what are the 2 or 3 things you'd say, look, Secretary of State, here's where, within this system, we've got stuff that we really need to focus on, where there's potentially a problem?
Well, I think the very big one, and the one that undoubtedly the Treasury will be pointing the Department of Work and Pensions to, will be how much we're spending on disability benefits, on supporting people who are in ill health, and how that's changing over time. And I say that because since around the summer of 2021, the number of people applying for and successfully getting onto these benefits has increased very, very substantially. So we're spending a lot more on these benefits than back in 2019. And according to the official forecast, they think that that's going to continue growing. So to give you a sense of scale on that, this includes children, working age, and pensioners, where all types of individuals can qualify for disability benefits. But you were talking around 5 million individuals qualifying through the 2010s. It's already up to 6.3 million, so that's up 20%. And it's forecast to rise to 7.7 million in a few years' time. The amount we're spending on these benefits, it's already up by £24 billion. So this year we're spending £24 billion more on these benefits in real terms than we were before the pandemic. And according to the March budget, it's going to rise by another £13 billion by 28-29. So what we're seeing here is very big additional costs that the taxpayer is having to support, not because we're actively choosing to make these benefits more generous to those who are qualifying for them, but because many, many more people are successfully claiming them. So clearly that raises questions about, are we targeting these benefits right? Are we supporting these individuals well? And of course, what's going on in these individuals' lives? All these individuals who are able to qualify for these benefits are in ill health, have extra costs or are deemed to have extra costs. It's sort of catastrophic, not just for the public finances, but also for those individuals.
Okay, so I'm going to be hyperbolic again, I'm afraid. Just again, the additional spending on these benefits compared with 5 years ago is more than £20 billion. So essentially, the amount that we've ended up spending more than we were is basically equivalent to, indeed more than, the black hole that Rachel Reeves and Keir Starmer keep talking about for reasons, frankly, we don't really understand. That actually the number of people applying for and being awarded these benefits has essentially doubled. Each month we're getting twice as many people starting on these benefits as was the case three or four years ago.
And Tom and a colleague in some work have published a graph which I think really illustrates this very, very nicely, that if you show what proportion of people by age are qualifying for a health-related benefit, obviously it goes up with age because people who are older at working ages tend on average to be in slightly worse health than younger people. But the increase since 2019, since 5 years ago, is basically 2 percentage points at all ages. So 2 in 100 more 20-year-olds, 2 in 100 more 40-year-olds, 2 in 100 more 60-year-olds are qualifying for these benefits relative to 5 years ago. So it's a sort of, in proportionate terms, it's a bigger increase amongst the young than amongst the old. It's about 2 in 100 of all age groups now qualifying for the benefits relative to 5 years ago.
And in terms of why, I mean, we know at a sort of broad level that a lot of younger people are coming on for reasons of mental health and older people for reasons of physical health. But do we understand beyond that what has driven this change?
I think it's fair to say no one really has a clear idea. There's a few hypotheses. Perhaps the one in which we do have the clearest evidence is just that the health of the population does seem to be getting worse. If you ask people in surveys, do you have a disability that limits the kind of things you can do each day? That has increased since the pandemic by a meaningful amount. Certainly, a couple of years ago when we looked at this, if you looked at mortality rates as well amongst working age people, that had also gone up since the pandemic. And so it does look like, obviously then this leads to another question, why is people's health getting worse? But it does look like people's health has got worse, and naturally that's going to have a consequence, disability benefits. But you could imagine other reasons that it might be going up. Perhaps the cost of living crisis, people feeling the pinch a bit more, and someone who, was perhaps on the margins of deciding whether or not to apply for one of these benefits or not. It's a somewhat time-consuming and costly process. Perhaps that was enough to push some people into applying. But it's something where, we don't really have a very clear idea. And I think it's fair to say no one really has a very clear idea. I
think it also points to the fact that in many cases, the Department for Work and Pensions, the Secretary of State for Work and Pensions, having to deal with situations where perhaps things are going out wrong elsewhere in society. So we talked about the housing benefit bill. Well, if the housing market's not working well and rents are going up a lot, that adds to the pressures on the department. If the labour market's not working well, if people are losing their jobs, or if there's external price shocks and there's a cost of living crisis, again, that puts pressure on them. And in this case, if people are in less good health, if the NHS is struggling, if health is deteriorating, then again, it puts a lot of pressure on the DWP. So it's in many cases, it's dealing with problems that have arisen elsewhere in the economy or elsewhere in society.
So there have been, the last government had some proposals for changing some of the ways in which health issues were assessed. Tom, perhaps you could tell us a little bit about that and what we know about where the current government is on this and anything else perhaps they might do to tackle this extraordinary increase in spending.
Yeah, so the previous government did announce a plan which hasn't, it's in the books, as they say, so it's kind of officially government policy, but hasn't yet been implemented, which was to basically make it more difficult to qualify for incapacity benefits. That's the benefits that are for those who are unable to work. And that, the OBR thought that would save 1.3 billion. So, I mean, if you compare that to the kinds of numbers that Carl was talking about earlier, where the spending is going up by something in the tens of billions, 1.3 billion, I mean, you'd rather have 1.3 billion than not, but it's relatively small beer compared to the kind of scale of increase we're talking about. That's the only policy that's kind of in the books, and I've at least not heard anything from the new government on whether they do intend to go ahead with that or whether they plan to cancel it. There were some other policies which the previous government announced which were out for consultation but haven't been formally decided, and they're somewhat fuzzier. But things like perhaps making it more difficult to qualify for disability benefits on the grounds of mental health reasons. And the then Prime Minister Rishi Sunak, he said, these benefits are supposed to be helping people because they've got higher living costs. If you have mental health problems, as much as that might make your life more difficult, perhaps it doesn't actually generate higher living costs. And so there was a consultation out to do a policy along those lines, and we'll have to see whether the new government wants to continue with something in that direction.
And I guess it is worth saying that when these benefits were designed, there was no expectation that a large fraction of the people receiving them, this particularly the personal independence payment, which, as you say, is supposed to cover additional costs associated with disability, it wasn't really the intention that a large amount of this would go to people with mental health problems or not. So there is an active policy decision, I think, that does need to be made by government, both for the purpose of the public finances, may also not be in the best interests of some people to be deemed to have mental health problems and to be able to not work. There may be also economic issues if people are kept out of the labour market, even though you can get this in work. Very few people do. People are kept out of the labour market as a result. But we know from previous attempts at change and reform in these sorts of areas that efforts to tighten up the criteria can be really difficult, both sort of politically and practically, and in terms of their impact on the individuals affected.
Yes, exactly. And personal independence payment itself is an object lesson in that. The government brought it in 2013. Goal was to save 20% off the disability benefit bill, which is a serious sum of money. And the OBR's best estimate after the fact, after it was implemented, was it actually increased spending by £1.5 billion. And that does go to show exactly this point, that if you try to reform the system to tighten it up, it can be quite difficult to actually do it in a way that really delivers substantial savings.
So, Carl, we've gone to the Secretary of State with a lot of problems here. Anything you would suggest that she does?
The area of disability and health-related benefits is incredibly tricky. I mean, clearly, if you want to save money in a straightforward way, you could just say, we'll make these benefits less generous, and that's going to give you a guaranteed saving. Clearly politically hard and would mean some people who are really very, very poorly getting less money. But that's the guaranteed way to make savings. The alternative approach, as Tom says, is either to try and say, well, we'll make it harder for people to qualify for those benefits. We've tried that in the past with really quite limited success. The other approach, and I guess the real win-win one, is if you can get people who are on these benefits to get them healthier, to get them back into the labour market, to get their incomes higher so they won't qualify for the means-tested support that they currently get. But again, that's very, very difficult to do. Certainly worth it in the sense of the gains for the households, the gains for the exchequer could be really big here. But it's not something you're going to do and deliver savings very, very quickly.
And also something that presumably would typically would cost money in itself. If the goal is to try and make people healthier and that gets them off PIP, kind of difficult to imagine ways to do that are going to be free.
Indeed. I mean, you invest to save, as they say, which for quite often good reasons the Treasury will be quite sceptical about. So a difficult one to crack, and a signal, as Carl said, of big things going wrong in the world, in the country, that so many more people are on these benefits. I think the first thing I'd say to the Secretary of State and the Department for Work and Pension is you really do need to do a lot more to understand what on earth is actually driving this. A big research effort here is worthwhile, because when you're spending whatever it is, 60, 70 billion pounds, am I in the right ballpark there in terms of the amount we're spending on disability benefits?
Rising to 100 billion pounds in 2028 on the current forecast.
So you ought to be spending a lot, a real lot, tens, hundreds of millions even, on understanding what's really driving this. And I don't think we're in that position at the moment. Well, that's sort of number one on the to-do list as far as working age benefits are concerned. Had we been having this conversation 5 years ago, or indeed 10 years ago, we would have been very focused on universal credit, which is, as I said at the beginning, this was still relatively new benefit which rolled together a whole series of means-tested benefits. It was the brainchild of Ian Duncan Smith, who was the Secretary of State during the coalition years. It was supposed to take 3 or 4 years to roll out. It's still not fully rolled out, about 14 years on, but we're nearly there. Where are we, Tom, in terms of that? In terms of getting universal credit done? I mean, is this something the Secretary of State can kind of sit back and just let it happen at this point? We've got this system. It's pretty much rolled out, and it's after some severe teething problems, we're nearly there, or is it? Does it need her attention?
It definitely does feel like we're nearer than we have been. So I felt like over my career that universal credit has always been about 4 years away from being fully rolled out. And it does seem like that time horizon maybe is actually shortened now. There's 1.2 million claimants left. So the bulk have been moved over. And the goal is to finish all that by the end of 2025. So only, whatever that is, 15, 16 months away. And the way that is going to happen is there's people who are still claiming that the legacy benefits, the benefits that universal credit replaces, they're going to get a letter. Some already have been getting letters telling them, you need to put in a claim for universal credit. Your legacy benefits will be stopped by such and such a date. And I think here that there are definitely challenges. So to give some statistics on this, I think are quite helpful. Last year, some tax credit claimants, I think about something like 400,000 tax credit claimants, got one of these letters saying you've got a claim or your tax credit's going to be stopped. And about a third of them didn't go on to claim UC. Now, in some cases, it might be that they decided they couldn't be bothered with the hassle. They may perhaps only entitled to a small amount or something like that. But also, it could be that in some cases, perhaps they were unaware the letter, it didn't didn't register with them for whatever reason. And for those people, of course, it would be a surprise when their tax credits then suddenly stop.
I suppose it's possible also some of them were receiving benefits which probably they shouldn't have been, and they decided not to reapply.
Yeah, potentially. Yes. That's
on that, is fraud and error something that the Secretary of State needs to be worrying about? Carl, do you have a view on that?
Well, I think it's certainly something that they do need to worry about. I get the impression that it's both sort of errors being made within the department, errors being made by claimants, but also sort of organised attempts to try and defraud the system, which occur periodically when essentially somebody discovers a weakness in the system and then tries to exploit it. And there's been some high-profile cases where people have been convicted of essentially creating lots and lots and lots of claims for different people and therefore defrauding the system of large sums of money, which I think they're very, very focused on. So that's clearly something to worry about, and it could explain why some of the tax credit claimants are not making it across. It could, of course, just be that tax credit claimants are in work, they're used to dealing with HMRC, they get a letter from DWP that says, we need you to claim universal credit, and to do that, you need to go into a job centre, you need to sign in a claimant commitment about what you're going to be doing in your life to try and get yourself off the support, and they may not be up for that, and therefore they're not eligible for universal credit purely because they don't wish to sign such a claimant commitment. They don't want to be engaging with a job centre. It
might be worth spending a moment or two on that, but that is a big difference in the sense that previously, if you were in work and on tax credits, you didn't have to, as it were, do anything other than get the money. You didn't have to engage with a job search or show that you were trying to get better paid work or anything like that. But now, broadly speaking, a lot of people moving on to universal credit will need to do that.
Yeah, they'll at least need to have some sort of engagement with the job centre. As Carl said, they sign a claimant commitment, and if their earnings fall low enough, they're actually required to try and they get hassled by the job centre to try and get more hours and so on. But I think perhaps an important group here in thinking about the universal credit rollout is not just these tax credit claimants, but also people on employment support allowance, which is the incapacity benefit, those who are unable to work because of a disability. There's still about 900,000 or 800,000 or 900,000 of them still to be rolled over.
And that's all happening by the end of 2025.
Yes, exactly. That's DWP's goal. And here I think there's probably more reason to worry a bit about this, that these people they'll be out of work, often getting reasonably large sums of money, in excess of £10,000 a year. And because it's a health-related benefit, you might expect that they're more of a vulnerable group. And if they don't put in a UC claim for whatever reason, when they get this letter saying you've got to claim UC, if they don't put in that claim and they suddenly see their, potentially all of their income disappear, that could be obviously something that's extremely difficult for them. And to be fair, DWP they say they put in extra support for this group, but I think this is an area where you could imagine, a not insignificant number of people going into real difficulty if the rollout doesn't go as planned.
Yeah, I think they have to go very carefully here. I think they're right to move people across to universal credit, not least because a good chunk of those people will be entitled to more benefit once they're moved across. And also because actually if they've been left on incapacity benefits for many, many years, there's been no engagement at all by DWP with them. And in universal credit, there will be some engagement, which hopefully can be done in a positive way that can help them. So I think moving them across is the right thing to do. The alternative is to leave them parked on these incapacity benefits potentially for many, many more years. But as Tom says, it's got to be done very, very carefully. You can imagine individuals with very severe mental health problems not seeing a letter from the department, not engaging with it, not feeling able to go and make a claim, just simply falling through the net and seeing their income fall quite dramatically. So I think the department has said that their approach in the early stages is always to go slow, then adapt and learn, and then only scale up when they feel that they're able to do it at scale. And I think that has to be the right approach.
But equally, as you say, remarkable. I think many listeners will feel that people have been left on incapacity benefits, as you say, for years and years and years without any further engagement, and hence you'd hope that some engagement will be a positive outcome.
Yeah, some engagement, and as I say, many of these people will actually find they're entitled to greater sums. Those who find that their universal credit award is actually lower will be given something called transitional protection, so they won't suffer a cash decline in their income at the point that they move over. So there are protections in place to help those even who would be entitled to less universal credit. And if the engagement and the support is done well, one would hope that it can help these people further.
Let's move on to that other big bit of the universal credit bill that we mentioned, which is the part which is allocated to supporting people's rents. That is knocking on for £30 billion a year. Again, an extremely big number. That's more than 1% of the whole of national income supporting rents. Now, that's partly because more, particularly younger people, are private renters than used to be the case. It's partly because rents have gone up. It's partly because a lot of people on relatively low earnings. Is this also a bill that's gone up a lot over time, Tom, or is this something that's just always been this kind of scale?
Yeah, certainly over the longer run, over the order of last decade or two, it's been steadily increasing the amount that we spend on it. The shift towards, as you kind of alluded to, Paul, the shift towards private renting is partly a contributing factor here. It tends to be more expensive than social rents, and you can't get a housing benefit if you own your home. And so it is an area where, the government has been spending more cash. I think perhaps, again, people will be surprised to know if you're a private renter, there's still a 2 in 5 chance that you get support for housing, either through the housing benefit system or through universal credit. So 40% of private renters are getting this kind of support.
Yeah, I mean, again, a colossal fraction. 2 in 5, 40%. Now, when I were a lad, many years ago, looking at this part of the benefit system, housing benefit effectively covered your whole rent. But part of the story of recent years is that despite this increasing bill, actually it's become considerably less generous in terms of what it actually covers.
Yes, certainly for private renters. If you're a private renter, the maximum amount you can get is governed by something called the local housing allowance, which varies depending on where you live in the country and the size of your household. And you can't get more than that. And the policy for local housing allowance has been pretty odd, in that it was sort of frozen over the latter half of the 2010s. Then in the pandemic, it was increased rapidly, and then it was frozen again. And then just this past April, it was increased again, so that you can basically afford the cheapest 30% of properties in your area. But the policy is for it to be frozen again. The official policy is for it to be frozen indefinitely. And that really matters when rents are rising pretty rapidly, which they have over the past few years.
And it's worth saying, Tom, that part of the reason the Chancellor quoted for changing policy to unfreeze it was that I think your work showed that it would only cover something like 5% of all properties on the market.
Yeah, that's right. New properties you could find to go and rent, it was only covering about 5% of them. And that is precisely because they've been frozen in a world where rents are rising very rapidly.
So do we know what fraction of people receiving this benefit are receiving less than they would do if their full rent were covered?
I think I don't know, because rents have risen so much recently. I'm not sure if we know with sort of very latest data, but it's certainly even before the pandemic, it was. I'm pretty sure I'm right in saying that it was most people who got it wouldn't get the whole rent.
Yeah. So this is an interesting example of something which, in a sense, for good reason, was made less generous because it was becoming incredibly expensive. And actually, it was an incentive issue here that if your landlord put the rent up and they knew that the government would just pay for it, then no one had an incentive to keep rents down. But it is an example of a part of the system which has become less generous over time and clearly creates some hardship and some problems for a lot of people, particularly if you're in work and you lose your job or your income goes down, you probably can't shift your rent very quickly. Yeah. So you're going to be struggling on less than the government feels that you should be living on. But I think that kind of speaks to some of the other pressures on the government, which is about how to or whether to respond to a lot of the cuts that have happened to the working age benefit system over the last 15 years. Some of these have been really quite salient. So we've heard a lot about the 2-child limit on benefits, which we'll talk about in a moment, which, as it suggests, limits the amount you can get. If you have 3 children, you still only get benefits if you've got 2. There's a cap on the total amount of means-tested benefits that you can get, which was introduced a few years ago. Some listeners may remember the so-called bedroom tax, which effectively meant that if you're in social housing and you, for example, you're a single person and you've got a spare bedroom, then the rent in respect of that extra bedroom won't be paid by the benefit system. So we also had a period of time when benefits were frozen in nominal terms, so the real value of a lot of benefits has fallen. Actually, that was the biggest of all the cuts by some distance. It's the one that never gets mentioned, but it was the biggest in terms of savings. So I'm absolutely sure that Liz Kendall is getting a whole bunch of people turning up saying, look, there are all these nasty cuts that happened under the last government. Can you undo them, please? What chance she's going to be able to do that?
Yes, so these things obviously don't come for free. So the 2-child limit, as you say, is the one that's getting a lot of attention. Reversing that will cost something like £3 or £3.5 billion a year. So it definitely
immediately or in the longer run.
I think that's in the long run when it's fully rolled out. But it's mostly rolled out already, and that's a few £1 billion. Certainly nothing. Is certainly a reasonably significant sum of money, not absolutely catastrophic. But perhaps that's the one that's getting the most attention,
and partly because, as your work, Tom, has shown, that cap is pretty well focused on increasing child poverty. I mean, there's been a big increase in the numbers of big families that are under the official poverty line.
Exactly, yeah. If you look at the child poverty rate for children who in 1 or 2 child families, the child poverty rate has fallen, and whether it's gone up quite significantly for those in bigger families. That's not only due to the 2-child limit. Big families tend to be more affected by benefit cuts in general, but the 2-child limit is certainly part of that story. And as you say, it is quite targeted on child poverty because if you think about it, if your household income drops below the poverty line, if there's 3 children in that household, the child poverty number goes up by 3. If there was only 1, it would have only gone up by 1. So it is quite targeted at child poverty, and that is particularly relevant when the Labour government said in their manifesto they wanted to have an ambitious strategy to reduce child poverty. They've set up a task force to do so.
It's worth saying, of course, the last government said there was a reason for doing this, which is that if you're on average sorts of incomes, you have to budget and think very hard about whether they have an extra child. And so the argument went, people who are dependent on benefits also really ought to be making those calculations and not simply depending on the state to provide them with the extra money. I don't think there's much evidence it's had a big effect on numbers of people having kids. And of course, a lot of people on benefits don't know they're going to be on benefits at the point at which they have their children.
Yes, indeed. That's true.
The benefit cap, Carl, I mean, this is something which surprisingly, in a sense, hasn't had quite so much coverage, at least since the new government took office, but it also has quite a big effect on a relatively small number of households, but it has quite a big effect on their incomes.
Indeed, it caps the amount of benefit income a household can receive. It, as you say, it affects a really very small number of households, and therefore, in terms of the public finances, it doesn't save very much money, but that small number of households that lose, on average, are losing large sums of cash. And essentially, it's a combination of being in a high rent area and having a lot of children in your household is what typically means that you're going to be affected by the benefit cap. The reason it doesn't affect very many households is simply because we already have the 2-child limit. So there's already a cap on the extra benefits you can have having more children. So the government's already capped that. And there's also caps on how much support you can get for your housing. So there's already a cap on how high those local housing association rates can go, which bind in certain parts of London. So we're already capping the housing support you can get. We're capping the child support you can get. But we're also essentially capping the interaction of the two, very loosely speaking. Now, where the benefit cap would really start to matter is if the government said, oh, yes, we're going to severely, very much relax or get rid of the 2-child limit. I think at that point, you would see the benefit cap have a huge effect, or perhaps more likely, the benefit cap would be got rid of alongside that point at that point in time.
Could you just remind us what the benefit cap is? How big is it?
It depends where it depends whether you live in London and whether and the exact composition of your household, but you should be thinking about in the low £20,000 a year.
Yeah, and again, I don't want to be the mouthpiece of the last government. They would say that if you're getting more than £20,000 a year in benefits, that's equivalent to someone earning not far off the average wage once you've started paying tax and so on. And they would argue not unreasonable, therefore, to not pay people benefits higher than that.
And of course, I guess earlier when we were talking about how many people receive benefits, of course, somebody on the average wage who had some children in their household who was living in a high rent area would also be qualifying for some benefits. So it's the kind of overlap of the two, which I also think confuses people sometimes. It's worth saying DWP did a very good evaluation of the benefit cap, and they found that it does lead to some households who would be affected choosing to move into work, not a majority by any sense, but some did. It does lead to some households trying harder to qualify for some benefits that would exempt them from the benefit cap and doing that successfully. What it doesn't have very much effect on is people moving to a cheaper area. The evidence on that is that it's really small numbers that would choose to go and live in an area where rents are much, much lower, perhaps because these are households often who have children, and therefore those children might be settled in a school, and there may be good reasons why you don't want to move.
And am I right in thinking the benefit cap only applies if you're out of work, and it doesn't apply if you're on disability benefits? Is that right?
That's right.
Yeah,
that's right. The exemptions for disability benefits, if you're in work, or indeed if you were in work, if you are in work and you lose your job, I think you get 9 months possible grace period as well. So it's for people who are out of work, been out of work for a few months and not receiving disability benefits.
So those are the sorts of things, no doubt, the government will be being lobbied on. We are coming towards the end of our time. Is there anything else in the working age benefit world that Liz Kendall will be thinking about?
So there is, we've alluded to it a couple of times, there is child benefit. That's the kind of major part of the system we've not talked about, where the previous government, we can talk about exactly how it works, but the previous government essentially announced that they were going to come up with a way of means testing child benefit based on your household income. At the moment, it's based on the income of the higher earning parent.
So you start losing it after your income goes over 60,000
60,000 now, yeah, and you lose it entirely once it hits 80,000.
For an individual. So if there's two people on 59,000, they get to keep it. But if there's one person on 80,000, the other has nothing, then you get no child benefit.
Exactly. And that's obviously a pretty weird way to means test things. The previous government said, we'll come up with a way of doing it at the household level, but have left that task for the new government. And it's not necessarily very obvious. It's not really obvious how to do it. Simply, the administration of it is difficult because the government needs to know for the millions of people that get child benefit who lives with who in order to do this sort of assessment.
Which, of course, they need for the universal credit system, but child benefit is administered separately, and this so-called means test is actually administered by HM Revenue and Customs. So it's an entirely different part of the system. And if I was going to be really nerdy, it's not really Liz Kendall's business, because this is administered actually by HMRC rather than DWP. But that's in a sense an unimportant technical detail. But it matters for this point about means testing it or taxing it away on the basis of joint income, because HMRC hasn't really done that for about 35 years since we moved away from joint taxation.
I think you're also pointing to what the obvious solution here would be, is that either keep child benefit as a universal benefit, nice and simple, does mean that some high-income households get it. Alternatively, you could just get rid of child benefit and make universal credit more generous for those with children. You have a means tested system in place that does all of that. DWP know about the joint incomes of households. What gets a bit weird is when you say, well, I want a means tested universal credit, but I also want a separate means test for this one bit of the system administered by a different government department that doesn't actually happen to know who lives with who. That's a very odd place to end up in.
Actually, I wasn't quite right there, was I? Because tax credits are administered by HMRC. Am I right?
Yes.
Yeah,
yes.
so I wasn't right about HMRC. No, mind you, let's not go into the history of the catastrophe of some of the efforts to means test tax credits and all the overpayments associated. But there's clearly going to be an issue there. I mean, yeah, again, like some of the other things we've talked about, the last government has left this government with some quite difficult things to do. Might sound like it makes sense to have a joint means test if you're going to means test child benefit, but really quite difficult to implement. We've scampered through a lot in the last little while, but we probably ought to start to bring this to an end. It really is, in so many ways, extraordinary and extraordinarily difficult, the working age welfare system. So as you'd expect, the Secretary of State in charge of this has got a lot on her plate. And we haven't even talked about the bigger half of what's on her plate, which is spending on pensioner benefits, the state pension and others. And we'll come on to that in another episode. It's extraordinary. In my lifetime, this wasn't just the Department of Work and Pensions. This was the Department of Health and Social Security. So you had a whole of pensions and working age welfare and the health service all under one roof. I mean, how any Secretary of State ever managed that is entirely beyond me. And one might say that history suggests that they didn't manage it. But so this is something of very, very big scale in terms of the amount we spend. It's very, very important economically partly because of how much we spend, but partly because of the impact it has on things like work incentives, particularly in this world where we're worried about this increasing fraction of people, certainly since the pandemic, who aren't in work. It's clearly very closely related to worries that we've got about population health, and it's going to be top of the concern pile at the Treasury as well. And beyond all of that, the human impacts of, on the whole, not very generous scale of these benefits. We have large fractions of people living in poverty, and most of those are on working age benefits of one kind, or many of those are on working age benefits of one kind or another. And clearly a short way of reducing child poverty is simply to increase the amount of benefits that go to families with children, and that's what the government says wants to do. So we've worked on this at IFS for decades and talked a lot about the trade-offs that exist in this system, and we'll no doubt come back to that. And I've no doubt that the new Secretary of State is being told again and again and again about these trade-offs and how difficult reform is. And she and the Chancellor and the Prime Minister will need to make these difficult political decisions about how to make those trade-offs. So thank you, everyone, for listening to this edition of the IFS Zooms In. I hope you found what we had to say interesting and informative. Thank you particularly to Carl and to Tom for, as ever, being fantastic guests and sharing with us their encyclopedic knowledge of this issue. I'm sure we'll come back to this in the future. It's such a big part of the fiscal picture. To see more of our work, do visit us at www.ifs.org.uk. And to further support us, please consider becoming a member for as little as £10 a month. You can find out more in the episode description. We will see you next time.